talking about diuretics. So basically diuretics, the pharmacological effect is to promote excretion of sodium and water through urine. So some considerations would be time and patient safety. So time meaning like you want it during the day rather than the night, because that can also lead to patient safety, or if they're on lace or on diuretics during the night, then they could potentially be at a fall risk because it's harder to see at night, especially older people. Anywho, moving on, that can definitely be something to look into. Patient education, educate them about potential hypotension and maybe signs and symptoms like a irregular heartbeat, where you want them to get up slowly because of the low blood pressure. And so moving on to the therapeutic effect of why diuretic could be used. So basically it's there to remove any excess fluid in the body, to treat things such as fluid overload, heart failure, hypertension. And then so some pre-assessments that you would look at before you give the medication would be like blood pressure, fluid status, labs. You want to check the labs, especially which one you would take. So like for example, Lasix loop diuretic, it's at risk for hypokalemia. And so adverse effects of that could be like dehydration, and that would be electrolyte balance. And so because of this electrolyte balance, we could talk about drug interactions, so like digoxin. If you have hypokalemia, it can lead to toxicity. And so that's definitely something, an adverse effect you want to look after. Now, after administration, you want to continue to monitor the blood pressure, see if it's dropped or not, trending the right way. You will want to measure the weight in INO from the baseline that you did pre-assessment, because you want to see if it's whether or not it's trending up or down, as well as labs and electrolytes, because you want to monitor things such as like calcium, sodium, as those are the main electrolytes that would be affected with diuretics. And so, which then leads to the efficacy, or just basically how effective the medication's working. So you would check if the blood pressure is going down, if the weight is going down, labs are still stable, which then you would go down to your physical assessment, or you could look at the edema, skin tuger, see if the hydration status, which then go back to adverse effects. Respiratory, listen to the lungs, see if there's any crackles or any signs of fluid overload, or levels of consciousness, if there's too much sodium or not enough sodium, going back to electrolyte balance. And so yeah, I think those are the main points about diuretics, things to watch out for, administering, therapeutic effect, considerations, and patient education.